Imagine a psychiatrist in Sri Lanka just months after the devastating 2004 tsunami. American-style PTSD clinics flood in, rewriting how survivors process grief. But what if this imported trauma story doesn't fit their reality? Ethan Waters travels the globe, uncovering how the American mind's blueprint for madness isn't just spreading, it's reshaping the world's emotional languages. What happens when the world's madness goes corporate, American, and uniform? Let's dive in. Waters journeys from Hong Kong's high-rises to Zanzibar's shores, witnessing a subtle cultural takeover, not of goods but of minds. American mental illness exports radically alter local experiences of distress. In post-tsunami Sri Lanka, therapists from the U.S. introduced PTSD diagnoses en masse, but locals, used to communal grieving and spiritual rituals, found their pain reframed as a clinical disorder. Waters observed how the American PTSD label flattened diverse emotional realities into a single, exportable syndrome. Think of mental illness as a contagious idea rather than just a biological condition. Like a viral meme, American psychiatric categories spread globally, embedding themselves in different cultures. This isn't just medicine, it's cultural imperialism disguised as science. In Japan and Hong Kong, Waters found indigenous understandings of madness, rooted in shame, social harmony, or spirit possession, being steamrolled by rigid DSM categories or American therapy models. What we lose is a kaleidoscope of emotional expression replaced by a one-size-fits-all Western medical worldview. From anorexia's rise in Fiji to depression diagnoses surging in Japan, American disorders appear everywhere, rewriting who we are and how we suffer. Waters recounts a startling moment. After U.S. television made its way into Fiji, teenage girls began exhibiting anorexia symptoms previously unknown there. Thinness, once irrelevant, became a new standard of beauty. American media didn't just offer entertainment, it altered bodies and minds thousands of miles away. Depression in the West often hits with guilt and self-loathing, but in Japan it manifests as social withdrawal and physical symptoms. However, Western-trained psychiatrists push a standard label, ignoring this variation. It's like fitting a square peg in a round hole, causing confusion, misdiagnosis, and mistreatment. Behind this spread is more than culture, it's political. Western pharmaceutical companies, backed by global institutions, fund diagnosis campaigns worldwide. Waters reveals a powerful machinery pushing American mental health norms as universal, often sidelining local knowledge and patient voices. Waters doesn't just expose problems, he reveals paths back to pluralism where madness is understood through many lenses, not a single American blueprint. In Zanzibar, Waters met healers who treat madness as a community issue, involving family rituals and storytelling, far from isolated clinical interventions. These local practices offer resilience and meaning, reminding us mental illness isn't just a personal tragedy but a cultural phenomenon. Across Asia and Africa, spiritual healers still lead therapy sessions that Western psychiatry might dismiss as unscientific. Yet these methods restore identity and social bonds, crucial elements lost in American clinical models. Waters argues true healing demands this broader view, beyond pill bottles and diagnoses. The book's Turning Insight, the global mental health project, only succeeds when we embrace local diversity, not bulldoze it. When madness is understood through varied cultural lenses, treatments work better and people feel seen, not forced into a foreign mold. Remember the tsunami survivors, their grief repackaged in American terms. Waters' journey shows that when we export our mental health norms, we risk erasing priceless cultural differences in how we suffer and heal. Next time you hear about depression or PTSD, try stepping back, ask, what if madness looked different here? It's a small act of rebellion that could change the world's mental health future. Subscribe for more book summaries like this one.